Welcome everyone. We're just waiting for people to join. We'll start momentarily. How are we going, Jenna? Are most people in now? Great. Welcome everyone. We haven't got everyone here with us quite yet, but we're going to get started. We've got a few things to tell you. We're also aware that your time's precious, so we don't want to waste it by waiting for the very last person to arrive. So welcome. My name's Elizabeth Deveny. I'm the CEO of Consumers Health Forum. I'd like to welcome you here today. And we're going to spend a little time with you talking about how we intend to respond to the Strengthening Medicare Task Force in the next few weeks and how we'd also like your support. I'd like to begin by also acknowledging the traditional owners of the lands on which we're meeting. Today, I'm in Wurundjeri country. I'd like to pay my respects to elders, both past and present, and acknowledge their continuing relationship to the waterways and land where I am, and also a special acknowledgement to any Aboriginal and Torres Strait Islander people who are on the call and joining us today. Welcome. So the Strengthening Medicare Task Force is something that many of you will be aware of. It was a task force convened by Minister Butler of about 17 people, and it met for about 6 months of last year and really looked at what could the government do to make Medicare work better. Had a terms of reference, which are public and available. If you haven't seen them, they're available on the government's website. And the terms of reference talk about the task force looking at an amount of money, it's $750 million, which has been allocated for this job of helping to improve Medicare. So the task force didn't talk about everything and anything. They really focused on how can we improve the way that the Medicare funded services work. In the report itself, there is a strong reference on consumers and communities being at the heart of any change. This is really important. We know that everybody, including everybody on the call here today, is a person who uses the system, uses the health system, and you've got really great insights about where the issues are, and more importantly, what we could do. And sometimes they're just small things we can do to really make the system work better than it does now and provide better value for money for the government. For those of you that do pay a lot of attention to social media and even the old-fashioned newspapers and, news, you'll notice that in the last few months, there's been a lot of conversation about GPs wanting, we've just gone one too far, thanks, Jenna. GPs wanting an increase in their funding, and various other groups also saying that $750 million is ours and we want it to be spent in a certain way. There are lots of large peak bodies that represent all of the health professions as well as all of the other commercial interests in healthcare, such as private health insurance, large pharmaceutical companies, and other various unions and organising groups for clinical workforce. Consumers, though there are 25 million of us and our taxes pay for Medicare, don't have the same kind of representation. We don't have the same kind of lobbying power. We don't employ, vast quantities of people to have dinners with members of parliament and encourage them to think along certain lines. We rely on all of you and all of the consumers that engage with us to, in their conversations with community, could be a barbecue, could be at the school drop-off, wherever it is, talk about what's important in health and how everyone can help to make the system work better. So what we'd like to do is encourage you to help us make sure that when this $750 million, or at least part of it, is announced in the next budget, which is only a few weeks away, and the government talks about how it will be spending it, what we want to see is that this recommendation here is funded. So there's actually money that goes towards the resources needed for every single one of you and many more people to engage with the government's processes. This might mean sitting on committees. It might mean looking at models of care. It may mean reviewing educational or communications documents to talk about what's changing. It might be involved in the evaluation of any changes to the way Medicare works. There's a whole lot of things consumers can do. And we want to make sure there's plenty of money there so that you can be supported to do that, and that your contribution is valued as it very well should be. That's the plan. So we do sometimes feel a little bit like David and Goliath, but there's a lot of us. So we're kind of mini Davids, if you like, and we hope that we'll be able to use all of our voices, raise them up, and really make sure that government's aware that we expect that there's some significant resourcing put towards helping consumers decide what's needed, make sure the models that are put in place work for consumers, and provide feedback early and often about what's working and what's not working. So I'm going to throw now to my colleague, Melissa, the Mesurier, who's working with us on the communications aspects of this work, to talk to you about, well, what is it exactly that you can do to help us make this happen? Thanks, Melissa.
Thanks, Elizabeth, and hello, everybody. I'm also coming to you from Wurundjeri lands and pay my respect to Elders past, present and future. So as Elizabeth outlined previously, what we're trying to do, there's 6 to 8 weeks left before the budget is finalised and then handed down. So that's slated for the 9th of May. So this intervening period, what we'd really like to do is make sure we keep the focus on consumers. So as Elizabeth just outlined, and as if you've read the Strengthening Medicare Task Force report, there is a really great emphasis on the role consumers can and must play. But for those who've been around the traps for a while, we've heard this all before. And in fact, I think we have a photo from the CHF office where we have almost 3-foot stack of different reports, many which have said the same kind of sentiments, although it's definitely stronger this time round. But really, you will surely agree that we don't want any more nice words. We want some action. So I guess this campaign, as Elizabeth said, is to keep that focus on consumers right up until the budget is decided, and they're right in the middle of deciding how and what will be funded. So we really need your help. I was tempted to put the old Uncle Sam, we need you picture here, but and that's the intent. So there's 3 elements of the campaign that we've designed, and one is called hashtag 30 years on. So that's really a reminder that although our health needs have changed and the population's aged and there's more chronic disease and a whole range of initiatives needed to address health reforms, not much has happened. So we thought a really good visual way of illustrating that is if we asked members and consumers like yourself to send us a before and a now photo, if you like. So a photo of yourself 30 years ago and a current one. And I'll go through some of the other things we'd love for you to help us with. And this collateral will be uploaded to a new website, which will be a microsite off the main CHF website, and we've secured the domain 30 years on. So that's both the social media handle and the website address. So I'll come back and talk a little bit more in detail. Obviously, if you're 30 or under, we would like you to potentially do the reverse, and that's send in a photo of you 30 years hence. And the younger people on the call may know there's various apps that will aid you to make you see what you'll look in the future. So I'll come back to that in a minute. The second part of that campaign is really, where are the consumers? And we came up with this hashtag a few weeks ago. Some of you may remember there was a National Press Club event where 2 GPs from memory, and a health economist, Stephen Duckett, spoke about the health reforms that the task force had proposed. Where were the consumers? Nowhere to be seen. So we've come up with this hashtag, where are the consumers? And we'd like all of you and anybody else that we'll be communicating through our channels, wherever they see reforms discussed in the media, or in social media, or at events, if there's no mention of engaging consumers or no evidence, we'd like you to repost or make a social media comment with that hashtag, where are the consumers? So again, just a little subtle reminder, especially when, as Elizabeth said, there's a lot of other vested interests here, various health professionals who tend to dominate the debates around health reforms, and quite often it's only lip service to the consumers. So we want to remind them that we should be in the room and at the table. And lastly, and this part is still being finalised, we have requested that a small group, probably about 6 consumers, will be able to meet with Minister Butler or his advisors to tell their health stories firsthand and reinforce why it is just so important that consumers are involved in these reforms. And obviously it's a busy period for the government leading up to the budget, so we haven't secured the date and time, and we'll come back to you once we manage to secure that. And depending on the timing, we might combine that with a media opportunity. So that's an outline. This slide here just gives you a little flavour of the overview. So we've got this key 10-day period, and I apologise for the tight turnaround, but that's what's required in these sort of short, sharp campaigns. Starting today with this webinar, then Monday week as the deadline for submitting your photos and stories, which I'll talk about in a minute. Then the campaign really hits its stride over the next 4 weeks, from 20th March to April. Obviously, we've got the Easter period in there. Then the where are the consumers, which really can run throughout the campaign, but we've looked at that week. And then obviously, as CHF always does, we'll be doing some heavy media commentary and media releases and the usual communications that the team does pre-budget week, and then reporting, hopefully, the good news about how consumer initiatives are being funded. So we're really hopeful that we'll have some good news, but it is a case of continuing to rattle the tin until we actually see the proof. So what do we need? We need your stories. As I said, we've got the deadline of March 20, which includes obviously this weekend and next. Many of us will have a long weekend. Hopefully this won't be too onerous on time. We're asking you for 2 good quality photos. If you've got an old one, you can take a photo of it or scan it with your iPhone if you have one. And again, we just want to have those 2 comparisons from today to 30 years ago. We would love, if you feel comfortable, for you to shoot a short 30-second video on your phone. It doesn't have to be high production values. Just pick a nice light area where we can see you, and talk about your health journey over the last 30 years and why it's so important for consumers to be involved. I'm happy to provide these dot points you'll see in a minute, but we want you to say it in your own words. 30 seconds goes remarkably quickly. When you're taping yourself, you might ask a family member or a friend to help you, but we just more emphasis on the number of videos we can get. We don't want you to do a Cecil D. DeMille production where you're worried about getting it perfect. We want it raw, authentic, and we want to hear your story in your words. If you don't feel comfortable recording a video, you could also choose just to write about 300 words, and we will post that on this microsite along with your photos and across our various other channels, social media and media. We often get asked for profile stories of real people. So a journalist will ring myself or Elizabeth, they'll want official comment from CHF, but then they'll also say, but can you give us somebody to profile? We can either pass on your photo and story, or they can interview you. So look, if it gets to that stage, I'll certainly support you more intensively, but I guess you have to be comfortable that if you supply these photos, videos, or words, that we can use them across. Now, we may not use all of them. The media may not pick up anybody, but we will choose to make sure there's a running commentary, so it really is on people's radar. So I hope that's self-explanatory. By close of business tomorrow, I'll send you an information sheet with a little bit more detail about what we'd be looking for, the quality of the photos, the type of format, and especially how to send us your video, because as you'll probably know, they can be very large files and it's not usually possible to email. So all those details will be in a sheet, which we'll send you. If anybody's not interested after hearing this to not be able or to have time to participate, please let us know and we won't annoy you. And we'll also, anyone who's very able to send us those things, we'll send you a consent form to make sure you are comfortable with us using your image or your words across any of our media. So hopefully that's self-explanatory. I won't read out these key messages. I think we've got some questions in the chat, which we'll go through shortly. But in essence, the key messages in the draft around there is, like I said, 30 years on when changes to Medicare were first proposed. Those of you who follow along closely will know Medicare is actually 40 years old, but it's really 30 years since the first changes were proposed. The system's changed a lot since then. The system hasn't changed, but health consumers have. But they haven't really had a really strong voice. We think we could amplify consumers' voice. As you've probably seen in the media, a lot of the debate, people equate reform as increasing the Medicare rebate to doctors, and that's only a small part of it. What CHF is really keen to ensure is that consumers have a seat at the table for any changes that are proposed or are going to impact them. We really commend the government for the Strengthening Medicare Task Force and all the people who contributed to it. But Elizabeth was the only person, I think, on a 15 or 16 person panel that actually represented consumers. So it is hard to get our voice out against much louder vested interests. And basically this second dot point really sums it up. The time's up for talking, action's required, and we really hope that the government will help fund us and help us work with consumers so reforms can be done once, done properly, and done in partnership. And one thing we continually reinforce through all our communications, and this will be more our communications rather than your stories, is that we're the only independent peak body representing Australian health consumers, and we are best placed to lead consumer involvement in policy and service reform. And we're very, very hopeful that we'll be able to get the funding to do that on a whole new scale. So I hope that's given you a sense. Elizabeth, you might like to talk to this slide and then we will go into some Q&A.
Great, thanks, Melissa. So we're recording this session, and when we send you the pack tomorrow with information, thanks, just leave it there for a sec. I'll just mention this because there was a couple of questions about it. We will send you a copy of the recording so that you can listen to it again. There are some people who registered but didn't get here today. We'll send it to them too. So if you have a friend or colleague that said, oh, I couldn't come at the last minute, don't worry. If they're registered with us already, we'll make sure they get a copy too, as well as Melissa's more detailed, this is exactly what you want, we will need you to do for A and B and C. But we would ask that you don't pass that on to anybody else. We only have a certain amount of capacity to support you. We've already identified a big group of people who work with us regularly, as you do, and that's probably enough people. We can't manage 500, 5,000, 5 million people wanting to be involved. So we'd ask that we'll send you all this information. You, if you can be involved, it'd be just terrific. And otherwise, that'll probably be enough, especially given the tight timeline that we have. So yes, show us the money indeed. So we want to see consumers supported. And as Melissa said, before Medicare, there was a different system. Some of you may be old enough to remember how things were before Medicare. Medicare came along. Everyone thought it was literally the best thing since sliced bread. But about 10 years after it started, the cracks started to appear. The Prime Minister's department did its first report into Medicare to show there were a few key issues that needed to be addressed. That's pretty normal. We've put a whole new system in place, and then we discover we need to do a little rework. But for 30 years, and as Melissa said, stacks of reports, saying pretty much the same thing, the changes haven't happened. And equally importantly, consumers' voices haven't been listened to. So we hope that if the government does what it says in the report and consumers are really engaged in this, then we'll be provided with some funding to set up a leadership academy. What this will do will allow us to have the people and resources to support you in your consumer journey, to be better at advocating for either your own health or sitting at a national roundtable, to provide you with key messages, other supports, teach you how to tell your story in the media without it traumatizing you. There's so many things that we could do to support you if we had the funding to do that. We also want to make sure that everyone knows how Medicare works. And so this literacy program would allow us to make sure that people everywhere understand what they can get from Medicare and how to do that. All the research that we see shows that the Medicare dollars are mainly spent in the cities for people who are more affluent, who speak English and who know how to get their things. And as a universal health system, the benefits of Medicare should flow to everybody, not just those that know how to use the system well. We also want to better understand what it is you want as consumers. And so more money will allow us to capture more of your stories and thoughts and tell your stories more effectively. And finally, it'll allow us to really, again, do other things like conferences and a range of other things to support your capacity as health consumers. So this is what we're hoping will come out of this, and maybe more. You know, I'm eternally optimistic, so I hope that we get enough money to do everything we could possibly imagine, even though the reality might be we get a very small amount of money, if anything at all, and have to choose one thing. So if you've got questions, and I'll go through the ones that are already in the chat, I really encourage you to put your questions in there, and then we'll go through these one at a time. If we run out of time and we can't answer all your questions, we'll look at them and we'll make sure tomorrow in the information that we provide you, we've answered those questions too, so you know what it is that you need to do. So I'm just going to have a little look through the chat now. I know some people have made some comments about some issues, like you, Evan, talking about mental health. That's great. So we'll just go up to the top, she says.
While you're doing that, Elizabeth, I might just mention to everyone, and there's some fantastic issues there raised by people in the chat. I think that the challenge will be for this particular campaign is to really focus on the key message on having consumers involved, because I guess the only way that some of these specific issues will be able to be challenged or consumers will be able to influence the change is if first consumers get a seat at the table. So that's the primary, if you like, objective of this campaign we'd like you to be involved in. So respectfully, I just ask you to think about when you do your message or your words, the overriding, pretend you are talking to your neighbour who really doesn't know much about potentially health advocacy or the health system, and make the overarching message, consumers need to be involved. And then if we know already from your previous engagement with us what your special interests are, and then we can engage you on those particular issues. But we need to get a seat at the table first. So I hope that helps us give it a little bit of the context. Over to you, Elizabeth.
Thanks, Melissa. There's a comment from Deborah, thanks Deborah, about making sure that health professionals know how to advocate on behalf of consumers, and also know how to respond to a consumer or their family and carers who are advocating for them. That's exactly the kind of thing that we think we'd be able to support people to develop, both consumers and also the health professionals who we work in with partnership in managing our healthcare. How do we work together What are the questions we might want to ask? What are the answers they might want to give? How do we create a safe space with the psychological safety so that everyone feels like they can say what needs to be said and aren't concerned about the consequences of saying what needs to be said? You've also asked for a definition. Deb will follow that up with you separately. And it's very important to hear, and it's terrific to hear that people are really interested in sharing all the kinds of stories that you're sharing there, talking about your own experience in healthcare and why it is important for consumers' voices to be heard, not just those people who actually get a financial benefit from the Medicare system. So really terrific conversation in the chat. I'll just ask if anyone has any questions, particularly about what we're asking you to do. So you can just put yes, got it in the chat if you understand. So we're asking you to have 2 photos. If you're 15 years old, then it's one now and then a filter to make you look 45. If you're 70, maybe it's one from now and one from when you're 40. And when you talk about perhaps when I was 40, I didn't have any health concerns and the system seemed to work fine. But now that I'm 70, I have a number of health concerns that can't be met. Maybe you'll talk about when I was 40, I was the beginning of a health problem that the system really didn't support me well. As a consequence, I'm perhaps sicker than I needed to be, or I haven't had the support that I needed. You'll talk about whatever it was. So yeah, Maureen, I had cancer when I was 30. How did the system work for you and how's it worked since? And what would you have liked it to do? Right? Because what we want is your stories of the governments have known for decades that there are gaps. Consumers have told them in lots of ways that the system isn't working, but they haven't fixed them. And we believe that telling your stories and having real people's faces, this is what I was like then, and this is what I'm like now, and the system has not supported me, and this is what I'd like change. And this is why you have to hear from me. You have to hear from actual people who use the system and can talk to you about both what it doesn't do and what it does. So if you've got a great story too about how the system has supported you, we're not saying only bad things. You might want to talk about how your GP has been terrific and how access to bulk bill general practice has been so important for you, how your GP has used a multidisciplinary care team, how your Aboriginal Controlled and Health Service has supported you. You can tell us all the great things as well that you want it to continue, but as well as the things where you feel that the system hasn't been fit for what you've needed. Because the chances are, if it didn't work for you, it didn't work for a whole lot of the people either. You're one of 25 million, but there might be another million people with the same experience as you. And that is, of course, what we'll talk about in our stories. We'll be saying, this is one example, but this is not the only example of where the system has let the community down, and the community need to hold you accountable as a government to make sure that the money that is your taxes, again, I would say, and your out-of-pocket costs is really spent in the best interests of everyone in the community, not only a small group in the community, because that's the whole point of having something that's universal. Evan, we're going to send you an email tomorrow with all the information you need. It'll say where you send your photo, what size the photo needs to be. Melissa mentioned if it's a video or a large file, what you do to get it to us. If you're going to write 300 words, which is just like a long paragraph, and tell a story, then this is where you'd send that to. We'll give you all of that in the email you get tomorrow, along with this recording and a couple other bits and pieces. Then if you're not sure, just reply back to that email address and say, I've got another question. And in the next week or so, we'll do everything we can to support you. And then, as Melissa said, we will be going, potentially to use these all this information will be used in media, so that might be social media like Facebook and LinkedIn and Instagram, as well as the big media like television and radio and newspapers. So you need to be comfortable that your photo might turn up somewhere or your story might be told somewhere. Happy to change your name if that's something that's important to you. Particularly if you decide not to have a photo, that's fine. If you want to manage your privacy, we can talk to you about all of that too. But for those of you that are having a photo or video, people in your family and your friends, they will see that video. And so you need to be comfortable that that would be okay for you in your social and personal circumstances.
And I might just add there, Elizabeth, you can certainly just use your first name if you like, as long as we know, obviously, your details. And you might, if you do a video, or your story, I think it was just looking back here, Maureen, who mentioned she's from a remote area, so that would be great. So if I was doing my own video, I would say, I'm Melissa, I'm 59, I live in Melbourne. These are the issues I've faced over the last 30 years. So I think, likewise, if you can say your age, where you're located, and if you're from any particular community, if you're representing any organisation, but we really want to hear personal stories rather than broad brush advocacy on specific issues. We will get to that. This is the first part of that campaign. So I hope that makes it clear to everyone. And if you've got any concerns, as Elizabeth said, don't hesitate to reach out. And we will, I think someone else has also asked if you can use them on your social media, Deborah. Yes, definitely. Just give us, please, this first 10 days, 2 weeks to go through all the things people have sent to us, and then we will stage the flow out, if you like, because we also want to make sure we get a really good cross-section of age, location, people's stories. So we'll also then, once we've got all the material together, we'll go through all our channels and especially direct to you to say, yes, definitely amplify this, put this on your own personal socials, etc. But just let us sort of compile all the best bits. We might have to do a bit of editing if some videos are too long or for whatever reason. But yeah, definitely the more the merrier once we press the go button.
Fantastic. So there are no questions in the chat that I don't think we've addressed. Melissa, would you mind just doing a quick check through?
Yeah, no, I think what I've great comments by Maureen, Irene, Deborah about your own personal story, and that's fantastic. All those, Maureen waited 7 years for a knee replacement. Absolutely, put that kind of thing in your story, whether it's the video or the written. We will certainly be trying to get that best cross-section. Kate says, do you have a budget that you aim to receive to achieve these goals? I'll hand that one to you, Elizabeth.
Yes, of course. We've got the small, medium and large size, and we put a submission into the Treasury as part of the budget process, saying what it is we'd like to do and how much money we would like to get. And then we also work with the Minister's Office and senior people in the Department of Health and talk to them about what it is that we'd like to do and maybe how much it will cost. A lot of that's confidential, so I can't share it with you today, but it's certainly not a small amount of money. It's a large amount of money. There are 25 million Australians, okay? So it's not $200.
Deborah's asked quite a specific question here about older photos. Yes, I was given a mammogram on a new machine with a handle. You're 1,000. Look, definitely, you've got to, as you say, you've got to laugh at some of the changes. But yeah, definitely, Deborah, I think my overriding, without going to everybody's specific details about their lived experience, is make it simple message and make it very clear. It's very hard to get into detail with 300 words or 30 seconds, and we will take all that information in the background as we go down this process. But the overarching message for your video, your story, is this is a snapshot of what I experienced, what's been good or what's been bad, and this is why I really want consumers such as myself to have a seat at the table. We need to be involved. So if I could beg your forbearance on that, we don't want lots of detail and we don't want your medical history. Don't share anything that you're not comfortable with. It's really, if you were a journalist looking at this site or a politician or a staffer looking at this when it goes live, there's one take-home message. Consumers have a lot of great expertise and lived experience, and we need a seat at the table. And it's people like you that will bring this, bring that passion that I know you all have and we all share to this campaign. So I hope that helps.
And we're going to finish up in a moment, and I'd like to thank you all for your time and just remind you that the Medicare doesn't pay for the entire healthcare system. So only those things that relate to Medicare, and that's particularly primary care. So primary care is the things that happen outside of a hospital. So seeing your GP, seeing your physio, your pharmacist, your psychologist, most of that is primary care. In the hospital is funded in a different way. It's not part of this $750 million. That's a whole separate several billion-dollar conversation that the federal government has with the state and territory governments. So when you're thinking about your stories, think about things that would have happened outside of the hospital. So I don't know, you might have had a procedure in a hospital, I don't know, a hip replacement, and that might have gone okay, but then when you got home, there were no support for you in the community. The GP couldn't be funded to come and do home visits to help you, or their nurse, those kinds of things that would have been valuable to you. Wouldn't you like it if Medicare funded those things too? So we'll make sure we make that clear to you when we send things out to you tomorrow. We want you to hear about the healthcare system, but given this funding is particularly about the things that happen outside of hospital, great to hear your stories about your pathology, your radiology, your GP, the nurse, the pharmacist, whoever it was, and how that whatever was funded right now wasn't enough to meet your needs, or in some cases was, and you want them to keep on doing it. So thank you all so much for your time. We really appreciate it. We'll be in touch with you tomorrow by email, and by all means, once you get that information from us, if you've got questions, just reply and we'll do our very best to help you. And we've all got our fingers crossed that if we raise our voices, we can make sure the government hears that we really need to have, as Melissa has said, and I have too, a seat at the table, not just the crumbs underneath. We want to decide how the system runs, and we want to make sure that it works for all of us, regardless of our circumstances. That's it, Deb. Collective impact, right? Lots of voices, and really important, all saying the same thing. Governments get confused when we all say different things. They don't know what we really want. But if we have these key messages and we all keep saying the same thing, consumers need to be at the table. Consumers need to be supported so they've got the skills to make a difference. Consumers' voices need to be heard. Consumers, if we keep saying those same things again and again, eventually the government will say, we've got it, okay? We understand what it is you want. And now that you've told us as a government, we need to respond in some way. And we're hoping that that is lots of big bags of money that we can use to provide a whole lot of support to everyone here and the many other that aren't here today. So thank you again. We'll be in touch, and best wishes with your photos and your videos and your little bit of creativity in telling your health story. I can't wait to read them all. I'm really looking forward to it. I'm going to do one too. Okay, thank you. Bye-bye.
Everyone.